Right now, there are more than 45,000 people with coronavirus around the world. The overwhelming majority are in mainland China, around the epicentre, Wuhan. More than 1,000 people have died, but many more have recovered. In Australia, there have been 15 cases, bringing the risks closer to home. Amid all the fear, we decided to ask two leading experts to give us the facts. First off, what is it, and how can you catch it?
Coronaviruses are a family of viruses, some of which cause a common cold. The main way this virus is spread is from what we call the respiratory route, in other words, coughing and spluttering.
What are the symptoms?
It can either be a mild illness with just a sort of sore throat and runny nose and feeling a bit unwell, to quite a severe and even fatal pneumonia.
Who's most vulnerable to the disease?
The most vulnerable in terms of severe disease do seem to be those with pre-existing medical conditions and the elderly.
Thousands of people are now in self-imposed or enforced quarantine, such as the passengers trapped on a cruise ship in Japan.
So this here is the outside of the block that we're staying in.
And on Christmas Island, 22-year-old Sydney-sider David Huang is among the many Australians in isolation.
So we start by cleaning up our hands with hand sanitizer first. No one's really shown any strong symptoms or anything like that, so it's probably fair to say that no one in my kind of block specifically has the virus.
Why is the quarantine period 14 days?
The incubation period, which is probably around 7 to 10 days, people could be infectious. We've set it at 14 days because there's a margin for error on that.
Fear of the virus has led to a nationwide shortage of medical masks. The government has released 1 million from its stockpile to health workers. But will wearing a mask really protect you?
We believe that a surgical mask is pretty good at protecting both the person talking to someone and the person who might be infectious, but there is no reason for the general community to be wearing surgical masks at the moment.
The origin of the virus is still unknown, but it's suspected it may have come from a wild animal market in Wuhan. So is there a connection to animals?
We know that coronaviruses exist in bats, quite a few of them, but how they get from bats into humans is a little bit uncertain at this stage. Sometimes you have an animal that's in between the bat and the human. They act like a host, if you like, and that may well be the case here.
This viral video that some falsely linked to Wuhan was in fact filmed in Micronesia in 2016. But there have been fears of eating out at restaurants in Australia. One Melbourne restaurant shut its doors temporarily after a man who had the virus ate there. So can you catch the virus by eating at a restaurant?
In a restaurant, like any other environment, you'd only be likely to pick up the virus if you're in close contact with someone, perhaps within a metre, if they've coughed on you or you've touched something that they've coughed on recently. Heating
and cooking food anyway inactivates most viruses. So even if it were there, and there's no evidence of it in Australia, the cooking process is going to kill it. So I think there's no risk at all eating in restaurants in Australia.
There's no cure for coronavirus, but researchers around the world are working on a vaccine. So, how soon could we see a vaccine?
I would be very surprised if even a candidate vaccine were available within 6 months, and it could be as long as 12 or 18 months.
That takes time, and I would have thought it's going to be at least a year or two before we had an effective vaccine.
And finally, when will the outbreak end?
I think it's far too early to predict what's going to happen.
If the Chinese have been successful with their quarantine measures and their travel bans and all of those sorts of things, and they limit the outbreaks in these other cities, then I think it's likely that it will come under control. But of course, this is all unpredictable at this stage.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.